Hi, everybody. Thanks for tuning in today. We're here with Dr. Andrew Kirschner. He has a solo practice in Bala Cynwyd, Pennsylvania. We're going to talk to him today about medical advice on the internet. So oftentimes when someone starts to feel sick or something starts to feel a little bit off or not normal, the first thing they'll do is turn to the internet for answers. So Dr. Kirschner, is this something that you think people should do?
The very short answer to that is no. Dr. Google doesn't really know you and doesn't know your past medical history. And oftentimes, if you just look up your symptoms, the things that are going to get the biggest number of hits on the internet are also the things that have the most sensational impact and very often have nothing to do with you. And so I hate having to talk patients down after they've read, that they're going to die on the internet, when most often what they have is probably something simple to treat. And so, no, I don't generally recommend that.
So, kind of going off of that, anyone can put anything on the internet. And what are some of the biggest issues you face with your patients being exposed to that and being able to kind of see anyone without qualifications put whatever they want out there?
Well, okay. So this week, that's actually really an important question. On social media last week, I went on a total tirade because of this hydrochloroquine thing that's being touted out there. You had some people who have no real medical background, no real medical experience, no real clinical background, touting this as like this miracle drug for COVID. Now, it's been studied through major hospitals, major institutions who have looked into its efficacy. And I've personally seen it employed in, no less than 30 patients myself who were being treated by critical care physicians who early in this pandemic were looking for literally anything that they could use that could help them. And it just doesn't work. I wish it did, but you see these videos that are coming out that suggest that it does. And so what happens is you have patients who are asking you for medications, preventively even, I don't have COVID, but I want this just in case, or I want to take it beforehand. It doesn't work that way. It doesn't work at all. But if you were to take their information and believe it, a lot less people would be getting sick from this right now. I mean, we all want this virus to go away, but no amount of magical thinking is going to make a drug that doesn't work.
Yeah.
So last week was a rough week because I faced that on the internet. I faced that in my office, with patients who had questions about this. And like I said, your physician is trained in this. Your physician has studied this. Your physician really wants you to do well. I want my patients to do really well. If there were a medication out there that fixed this problem, I would be using it. And I just don't like the misinformation that's being handed out on the internet.
Yeah, that makes sense. That seems like it would be something particularly frustrating.
It's maddening. Like it's absolutely maddening. Like you want to do your best by your patients, and they come to you with these things. And look, I understand the concerns. They want what's best for themselves too. I mean, understandably. But at the end of the day, a physician has to make treatment decisions based on what works. So there we are.
So, the hope would be that your patients or patients in general, to anyone, wouldn't be just Googling things or trusting what they see on the internet. But if a patient does do that, do you recommend that's something they bring up to their primary care doctor or whoever they're seeing, or should they just let that doctor kind of go with it themselves and what they know?
No, but listen, I have no problem with patients asking questions. I like patients who ask questions. In my practice, the treatment plans that I have for almost anything are a collaborative effort. It's not just me telling you what to do. It's us figuring out what the plan for your long-term care should look like and what your short-term care should look like if you get ill. You should feel comfortable enough with your physician that you should be able to ask questions. And if your physician isn't willing to answer your questions, you might want to find a different physician.
That makes sense. Well, thank you so much for answering these questions today. Maybe spelling some information that's important for people to know about things on the internet that they can't always trust. Final question, if someone wants to learn more about you or your practice, what's the best way for them to do so?
You can check out our website, which is linked in the video, or you can call my office manager, Turquoise, at 617-9355, and she'll help you set up an appointment.
Perfect. Thank you so much for taking the time today.
Thank you for taking your time to speak with me. I appreciate it.
Have a good day.